Hello, everyone, and welcome to another audio podcast. In this audio podcast series about the equity intermission, this is the Shientist, and this is part of a Storm Robotics production. In today's audio podcast, I'm going to provide an overview of a sort of a an effort that related what's referred to as a topic tagging activity in relating to identifying what is deemed as clinically relevant context in according to works or where works in relating in relating to uh, to particular social media platforms, and where between the two social media platforms, where members between the two social media platforms are highlighting are highlighting um, uh, uh, different experiences, lived experiences, as well as sharing sort of understanding around different areas of uh, uh, around different areas of healthcare practices. The work around this has been peer reviewed, and it has been published. It was published in the Journal of Clinical and Biomedical Research in 2000 and in 2000 in 2021, so just last year. And the full works is available through the Renal Patient Support Group, the RPSG, and the full title of this particular work is Integrating Healthcare Education for Best Practice: A Question of Which Health Professionals Between Pediatric and Adult Chronic Kidney Disease Patients, Topic Tagging, and What is Deemed a Clinically Relevant Context. And it was a sort of qualitative perspective. Um, um, uh, uh, although having said that, although there was qualitative perspective, but there is some works in in the peer review paper that has quantitative uh, perspective as well. Um, okay, so a little bit around this in related to um, the in relating to an introduction. So the proliferation of cheap and easy access to information and communication technology, or ICT, over the past 2 decades has created opportunities for research data to be collected through several media unavailable to previous generations of investigators and researchers. The move to collect quantitative data through using the World Wide Web on the internet was a relatively small step, building on already established data entry systems. However, the use of online methods to collect qualitative data required a more significant shift in mindset to take advantage of the benefits offered. Research data may be collected to highlight or outline a specific issue, or to substantiate and validate and present research across age groups and diverse backgrounds. When using qualitative methods, the researcher is the instrument and thus requires specific skills. Qualitative research, often uses open-ended data collection methods. For example, direct observation direct observation of participants is common in experimental and qualitative research, and there has been a growing intrigue in qualitative research methods in health and in healthcare, often associated with different allied health professionals. However, the emphasis on evidence-based medicine, or EBM, accompanied by a recognition of the importance of quality of life, has prompted healthcare professionals of all disciplines to acknowledge the value of qualitative methods. So, just to add on that, traditionally or retrospectively speaking, qualitative research, at least from a healthcare perspective, mainly in the main, was a focus around nursing professionals. However, that's no longer the sort of perspective. Generally, various allied health professionals are in context of healthcare can get involved in sort of a conducting qualitative research. So evidence-based medicine requires the integration of individual clinical expertise with the best available external clinical evidence from research, combining evidence from qualitative and quantitative research, and this creates an opportunity for improving the way care is provided, the way healthcare is provided. The findings of qualitative research can complement quantitative studies, offering insights and explanations relating to individual or cohort experiences, attitudes, and beliefs in order to inform and better develop healthcare strategies. In this work, there is a table that summarizes some of the main differences between qualitative and quantitative data collection approaches, and I will make a reference to that a little bit later as I go through. But now I'm going to talk a little bit about chronic kidney disease, which forms the sort of basis of this work as well. So chronic kidney disease is regarded as a public health issue globally. The long-term condition affects 10 to 16% of the general adult population in fast and slowing developing countries. 5% of the United Kingdom population suffer from chronic kidney disease stages 3 through 5. The characterization of CKD at all stages is an important part of its management and allows the initiation of appropriate treatments with the aim of slowing progression of kidney disease. Chronic kidney disease in children and young and adults is characterized generally by kidney damage or a decrease in what's referred to as the glomerular filtration rate. Now, providing up-to-date health information is pinnacle for patients to take ownership. The most important and the most recent definition for chronic kidney disease describes kidney damage at a glomerular filtration rate of less than 60 mL per min for 3 months or more, recommended by the Kidney Disease and Quality Outcome Initiative, or KDOKI. In a United States pilot investigation focusing on pre-dialysis education, several modalities of interaction and dissemination for education were evaluated. This included face-to-face education and online sessions. And the endpoint was patients' ability to select renal replacement therapy, or RRT, modality right for them. 3 assessment tools were utilized to compare groups, including chronic kidney disease knowledge, literacy, and quality of life. Education sessions were auctioned over actioned over 5 hours and over three particular sessions, and the study was undertaken over a 3-year duration, wherein 240 consented to take part. It was recognized that education is required to support chronic kidney disease patients with a smarter understanding of disease and treatment options. Patients wished that they had been educated earlier, irrespective of face-to-face or online modality. So I'm now going to highlight some of the aims and objectives of this work. So the changes in technology and the way healthcare is delivered to patients has been changing, and the nature of allied healthcare and the role and the nature of for specific areas of healthcare for allied healthcare professionals around chronic kidney disease is also or has also advanced or changed. So, for example, healthcare scientists could have more educational advice focus roles and supporting interpretation of test investigations, where traditionally they are healthcare professionals who are behind the scenes in healthcare delivery. Technology also prompts change in relationship between areas of kidney care and healthcare professional involvement across healthcare sectors. So this aims the aims and objectives of this UK study included three main things. Number one was to understand which topics and subjects are pertinent to chronic kidney disease patients. Number two, to understand whether retrospectively there has been an educational neglect as part of healthcare delivery. And number three, to understand how healthcare and education for chronic kidney disease patients could be more integrated. The aims will be achieved through topic tagging and identifying threads and discussions close to 2 decades between two peer support groups. I'm now going to highlight some of the methodology around this. So the research team developed a topic tagging activity wherein topics between 2 social media platforms, the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDAS for kids, having understood the aims and the remit of the social platforms. Topic tags were developed against 14 different topics, having extensively investigated over 1 month. So this was in March and April 2020, the most popular sort of terminologies. Topics were tagged for 2 weeks, per social media platform. So 2 weeks, for example, through the Renal Patient Support Group, the RPSG, on an online social media platform for the adult chronic kidney disease population, and 2 weeks through KDAS, the Kidney Disease and Renal Support Group, KDAS for kids, an online pediatric and young patients social media platform for those young people going through chronic kidney disease. Now, topic tagging retrospectively would help in the understanding of what areas of healthcare are popular and where patients between 2 groups would find health professional involvement further supportive. Thematic analysis, around surrounding this work was used to highlight findings according to overarching themes, but having used particular software to code and help understand where there are healthcare educational inefficiencies, and to also identify what information needs or requirements still need to be met in the care for both pediatric and adult chronic kidney disease patients. So in context with this, I'm going to highlight a little bit around patient and public involvement. So more research is now highlighting how patient and public involvement is important to help understand gaps across healthcare. To this end, several authors have informed that to understand how best practice should be implemented, how best practice should be implemented. In this light, it is crucial that research has patient and public involvement work stream or task force to help focus research and bring broader transparency. Additionally, it is imperative that any research methodology implemented is streamlined and based on potential participants groups' ability and capacity to get involved and contribute. This is also where it has been highlighted that if a researcher chooses online methodology to collect data, maintaining confidentiality is an overall deciding factor for participants who would otherwise not get involved. So whilst there is growing literature, frameworks and guidelines are yet to be published surrounding patient and public involvement in health research, at least to particular perspectives. The involvement of patients in decisions about healthcare planning and service provision has been introduced in several countries. The public involvement and support are needed to promote areas of research, and the research needs to reflect again public intrigue and values. Patient and public involvement is generally a main element and in and around areas of healthcare research in the United Kingdom, and patients should be part of the solutions to establish sort of beneficial health research. I'm now going to talk a little bit around the patient and public involvement workshop that had been implemented as part of the topic tagging effort that followed subsequently. So patient and public involvement workshop implementation. So patient and public involvement is an important mechanism. Involving patients and carers in this work had led a streamlined focus and research rigor. Now, the National Institute of Health Research sort of document surrounding involve best practice guidelines were followed before patient and public involvement in implementation. So this research, the research was co-developed between patients and researchers between two social media platforms where founders and administrators were able to highlight gaps surrounding aims and objectives through to study implementation. As part of this work, 13 team members, so for example 7 through the renal patient support group and 6 through the kidney disease and Renal Support Group, KDARS for Kids, initially attended two high street community workshops. In Bristol City, in the United Kingdom, in May 2019, and in June 2019. And before topic tagging activity, founders of both pediatric and adult renal social media platforms highlighted an understanding of how members use groups for sharing of experiences and understanding surrounding chronic kidney disease. The evaluation and feedback helped the research team understand how patients view surrounding the evaluation and feedback helped the research team understand patients' perspective surrounding access to healthcare education and information to focus this particular work. And in this peer review publication, the feedback and context can be identified in some of the tables that have been some of the tables that are included, and some of the supplementary context that is in this work. I'm now going to just talk a little bit about the around the development and implementation surrounding the topic tagging, and then I will talk a little bit around the ethics aspect around this, and then go on to talk a little bit around the results, the results and information around that. So topic tagging, development and implementation. So topic tags were then co-developed wherein a research intern was involved on behalf of the renal patient support group, but was involved between the renal patient support group, the RPSG, and the kidney disease and renal support group, or KDARS for Kids, and worked with the founders to understand what areas of kidney health and care is popular using a search facility through the Facebook social media platform. Through the social media platform in both across both social media platforms, and both of the social media platforms are referred as what is known as closed sort of support groups. The team organized a sort of a co-production meeting wherein it was discussed and decided that given that both groups have international membership and global reach, it would be important to ensure that topics and tags applied to the general renal population, and not specific to pediatrics, and not specific to the adult population. This would help gain maximum number of topics tagged between two groups, and this work aimed to tag as many topics according to designated topics or themes over 1 month duration between the two groups, as mentioned. And there's a table in here, and I will make reference to this as well, where it provides topics that were identified and tagged. A little bit around the ethics around this now. So all members between two groups were informed to refer to the group disclaimers. So there's a group disclaimer at the top or at the side of the renal patient support group, the RPSG. There's also a disclaimer on the kidney disease and renal support group, or KDARS for Kids, and generally all members were prompted or encouraged to refer to the disclaimers, and that and as part of the duration, were informed that topics would be tagged. Administration teams between the two social media platforms, between the pediatric and adult kidney social media platforms, um, were had highlighted, had put some context in a written form, and pinned that context at the top of the social media platform groups. So so they pin them as pinned context at the top of the groups as announcements at the top of the social media platform, so that members would know, number one, topics will be tagged to help identify sort of experiences relating to themes and subject entities, and number two, to highlight how topic tagging activity is being conducted to identify discussions relevant to health focuses and scenarios sort of more swiftly, and thirdly, overall highlight how two kidney care platforms help searching out information on across ongoing aspects surrounding kidney care and support. So these main things were highlighted in sort of at the top of the social media platforms. And in line with that, as part of the topic tagging activity, members between both groups, both social media platforms, were informed that topic tagging and confidentiality would remain in the group, would remain between the two social media platforms. Group disclaimers also prompted informed consent, and consideration for the need for ethics approval was made, and the Department of Health guidance was consulted, and the main guidance was a document was the governance arrangement for Research Ethics Committee 2012. Ethics Committee approval was not specifically required for this work. However, General Data Protection Regulation 2018 was followed throughout. And to that point, or to that aspect, the General Data Protection Regulation. So on the Renal Patient Support Group on the RPSG website, there is some context relating to how the General Data Protection Regulation specific to the RPSG, but also would be applicable to KDAS, the Kidney Disease and Renal Support Group, were owing to being social media platforms primarily being used on Facebook, then GDPR would fall under the guideline or remit under Facebook primarily. So I'm just going to highlight a little bit of context around this. So primarily RPSG and KDAS are both closed Facebook support groups, and both platforms are for patients and carers in chronic kidney disease. RPSG and KDAS are covered under Facebook's data privacy and protection policy. The General Data Protection Regulation, or GDPR, creates consistent data protection rules across Europe or EU, across the EU. The GDPR has been in effect as of in effect as of the 25th of May 2018, and applies to organizations based in the EU, as well as to companies around the world who provide or offer goods or services, and who process data from or about people in the EU. In keeping with GDPR, the data, the research team have not reported and when this research was being conducted, the research team did not report any personal identifiable data, or for example names, dates of birth, addresses, or locations of any of the participants. The GDPR and data protection guidelines were adhered to and applied throughout accordingly. I'm now going to highlight some of the results around this, and I will make a little bit of reference to some of the tables in this work as well. So the RPSG at this time when this work was conducted, and this work was published in last year in 2021. So the RPSG at that point had just over 8,000 members. Adult 8,000 members going through chronic kidney disease from the adult population, and KDARS, the kidney disease and renal support group for kids, or KDARS for kids, had just over 1,500 pediatrics and young people patients. And there is in the peer review works, there is actually some supplementary information in relating to that. Between the two international support groups or social media platforms, 2,560 threads were tagged against 14 different topics, and again I will highlight the different topics. Results here informed that patients between both adult and pediatric cohorts still require additional support across several areas of kidney care, and this retrospective trend analysis provides sort of a snapshot qualitative data of topics and in context in relating to evidence base from two renal online cohorts over 16 years. So it's over 16 years because of the duration between the conception of both organizations or both social media platforms. So topic tags and qualitative data. So the RPSG and the adult population. There's information relating to that in one of the tables in this peer review publication, and as another table, a separate table in relating to the pediatric and young population in another table. And again, I will highlight some of the context there. But before I do, four main themes were identified through this study, including number one, using different mediums to collect qualitative data and understanding healthcare. Number two, reliability and validity of using the internet to collect data. Number three, healthcare patient and public involvement and maintaining confidentiality through online methods to collect qualitative data. Four, advantages, disadvantages, and limitations to online data collection and peer support groups. And five, using qualitative methodology to understand educational needs for chronic kidney disease patients. In addition, this study informed that social media groups or platforms between adult and pediatric cohorts discussions are not just clinically relevant, but also form pinnacle understanding of where the gaps in education have been almost misaligned for patients close to 2 decades, nearly 2 decades. Now, I'm going to highlight some of the things that I mentioned in relating to some of the context in the tables that have been that I said I would I will refer to. Table 1 in this peer review publication highlights the differences between quantitative and qualitative research, and the context relates the characteristic side of things, and then the quantitative perspective and qualitative perspective as well in relating to sort of approaches, analyses, in relating to, for example, the philosophical base, the goal or the objective, the question that's being asked or posed, the setting, the study population, the sampling, the approach, the analysis, the result, the researcher, the presentation, and the typical model. And the table had been adapted from a peer review publication from a paper that was published in 1998. So table 2 in this peer review publication highlights the summary of the main topics developed and tagged between pediatric and adult kidney support groups. So the main ones, the topics developed and tagged, or co-developed and tagged, were number 1, lab tests and biomarkers; number 2, biopsy and surgery; number 3, diet and nutrition; number 4, renal replacement therapy; number 5, psychology and related; number 6, medication and pharmacy; number 7, lifestyle; number 8, primary care or GP; number 9, wellness and well-being; number 10, nursing; number 11, exercise; number 12, educational and interactive; number 13 was peer support; and number 14 was COVID-19 and infections. In table 3 in this peer review works, there is a preliminary, some of the main data that relating to topics tagged, and the qualitative sort of perspective from the adult population. And one of the things that the research team did was where once topics were tagged, the research team was able to backtrack to the earliest time where a particular theme were related to, where particular themes were derived according to a particular topic. So, for example, one of the earliest posts relating to a post on the renal patient support group, or the RPSG, for example, was around lab tests and biomarkers, which was where a patient or a member of the RPSG posted in 2011. And I'm not going to read the patient context, but the patient context, alongside the patient context, is a context related to citation and the evidence base, where alongside with the patient context, the citation was used to make a sort of a reference in line according to that particular theme and topic. And the same was for other topics and themes. So there was others for peer support. There was one around 2012, and there's a citation or a reference in relating to that. And COVID-19 and infection, there was a post that was that related to 2020, and a citation and reference had been made in reference to that as well. In the topics tagged and qualitative data in Table 4, the related pediatrics and young people, the young people social media platform, there was one of the earliest posts. One of the earliest posts was from 2017, which related to diet and nutrition, and there's a peer review publication from a pediatric perspective, which related to that particular theme, or citate that particular theme and topic that was tagged, and again, so table 5 in this work highlights, in this peer review publication highlights, table 4 in this peer review publication highlights the themes and against the different themes in context of the topics that were tagged. And in theme, in table 5 was an overview of the comments that came out from that had been in part of the work, one of the workshops that took place in May 2019, and there's another table that highlights some of the context that came that had been part of the workshop that took place in June 2019 in table 6. The supplementary information in this peer review publication highlights some of the context around the backdrop between the renal patient support group, the RPSG, and the kidney disease and renal support group, or KDARS for kids. And in this work, there was 5 main themes, so theme 1 was using different mediums to collect qualitative data. Theme 2 was reliability and authenticity of using internet to collect data. There was theme 3, which was healthcare and maintaining confidentiality through online methods to collect qualitative data and patient and public involvement. Theme 4 was advantages and disadvantages and limitations to online data collection and peer support groups. And theme 5 was highlighted using qualitative methodology to understand educational needs for chronic kidney disease patients. And generally in this peer review publication, the theme 5 highlights more context in relating to those different themes that are listed in tables 3 and 4 in this peer review publication. And so I'm now going to just highlight some of the context in relating to the discussion and some conclusions and some limitations around this particular work, and then some recommendations. So discussion. So, to begin with the discussion, retrospectively, methodologies for data collection have become more diverse, and the way patients are encouraged to get involved in research is also becoming of intrigue. However, over 2 decades on, 2 important questions still need to be answered. Number 1, in the United Kingdom, in the United Kingdom is primary care ready to support patients through technology and e-health as highlighted. And number two, is there a broader role for allied health professionals to be involved in education provision for chronic kidney disease patients in primary care? And so to facilitate that aspect, this step should be accompanied by strategies to support patients interpret and ascertain education provision around disease trajectory. This would also build patient-professional communication. Security and reliable connectivity maintained by the National Health Service is important, and this would allow faster transfer of information so that patient care is better integrated between National Health Services, for example, and ultimately providing education and prompt informed shared decision making. So the conclusions around this is that patients between the two social media platforms have educational needs, and thus to broaden access to sort of broader sort of an array of different healthcare professionals online or otherwise would be important to support best practice in future. Allied health professional groups may increasingly find themselves taking on different roles, particularly where involvement is increasingly dependent, bridging educational gaps and alleviating misinformation. So misinformation through technology and online spaces. Kidney care and nomenclature is also continuously advancing or changing, and thus it may be appreciated that it must be appreciated that patients should be armed with more appropriate context and information so that they are able to have communication and discussions with health professionals and service providers. To this end, it is now time that patients have access to different health professionals to help bridge areas, educational advice and support. So the limitations around this work were, whilst topic tagging had allowed a good understanding of where gaps in healthcare education for chronic kidney disease patients could be bridged, qualitative data presented only provides a snapshot. Topic tagging for 1 month per social media platform or more could have offered opportunity to identify more experiences between adult and pediatric support groups or social media platforms, and thus helped conduct more in-depth analysis. So I'm going to highlight some recommendations in here. So researchers are encouraged to build opportunities for patient public involvement focused practices, so thus to increase best practice and evidence-based healthcare. Prospectively, online multidisciplinary team and group consultations should be envisaged, wherein education is also part of follow-up involving health professionals. This would help integrate care and increase patient-reported outcome measures. In the United Kingdom, patients and professionals should be proactively co-developing initiatives, including joint telehealth educational consultations. Such initiative should complement healthcare and peer support involving expert patients to help provide supplementary care. And finally, I thought I would highlight a little bit about what this work adds sort of overall. So there are several ways to ensure robust data collection. Experimenting and implementing different online methodologies can broaden recruitment and participation. This study or this investigation highlights educational gaps in what's been referred to as a technological age for adult and pediatric chronic kidney disease patients. This study informs that in addition to online and peer support groups and social media platforms, there should be efforts to prompt educational support digitally, including webinars, podcasts, and other online medium to help bridge gaps to prompt informed decision making. And finally, 14 topics co-developed and tagged is enough to begin. It was enough and has been enough to co-develop educational modules to both complement clinical practice and integrate education into a chronic kidney disease integrate education into chronic kidney disease care pathway. And just to a quick acknowledgement in this work. The authors and the lead authors and the lead and co-authors would like to acknowledge those who were involved in this research from the beginning, and again in the works they are named in relating to the authors and co-authors, as well as the members of the Renal Patient Support Group and the Kidney Disease and Renal Support Group, or KDARS for kids, as a general membership between the two social media platforms. I now draw this audio and podcast to a close. This was an audio podcast relating topic tagging and what is deemed clinically relevant context. This is an audio podcast in the series about the equity intermission, and this has been another Storm Logistics production. Thank you for taking the time.